Thank you, Win, and thank you, Onan. Let me invite our next speaker, Laurie Heisey. Laurie is a senior lecturer in social epidemiology and the director for the Center of Gender, Violence and Health at the London School of Health and Tropical Medicine. Thank you.
It's not so easy here, is it? Hold on a second. Great. Well, I'm really pleased to be here today and to be part of the conversation. It was interesting, when I was coming on the plane, it occurred to me that it was actually it was 30 years ago, almost to this month, that I first came to India. I was sent here because I was doing work for an organization on women-led, the impact of environmental degradation on women. And so I was going up into the northern Garhwal Himalaya to talk to the women of the Chipko movement, who were doing work around trying to stop the deforestation of their watersheds. And in spending time with them, I asked a simple question that I always was asking when I would go and talk with women around the world. If you could do one thing to make your life lighter or better, what would that be? And quite frankly, I was sort of fishing for, like, I don't want to have to travel 50 minutes a day for firewood, because that's what I was writing on. But the number of times that something related to their husband's drinking and beating came up really shocked me. And I had worked on violence against women issues in my own home country in the United States, but it sort of amazed me that these women that had so many struggles were choosing to prioritize this, and yet it wasn't being discussed in any of the sort of global forums at the time. This was in the early 80s that I was working on. And so that sort of began an odyssey that has become my sort of life passion and mission, which is to try to understand more about specifically violence within relationships, and working together with women's groups and others working in low and middle income countries. So what I want to do today is just briefly do three things. One is I want to tell you a little bit about what we've learned over the last 30 years about the phenomena. I want to give you some of my own personal reflections about some of the kind of course corrections that I think it's time for us to be making as we think about preventing violence over the next decades. And third, I want to share with you just a little bit of some research I was doing specifically related to the topic of this symposium on the gendered nature of violence. So first, what are some of the things we know? Well, one thing we know is that of all the types of violence that women experience, it's violence within intimate partnerships that is the most common. And that this is even true amongst women living in conflict settings. So while, yes, sexual violence and conflict is a hugely traumatic event, the surveys that go on in those regions also show that those women who have been victimized in conflict, a greater portion of the violence that they've experienced in their lives is frequently from men that they know. Another thing we've learned is the health effects are long-term. So while people used to think about injury as the primary outcome of domestic violence, we now know that women and men, for example, who are abused, have much higher risk of having chronic diseases like chronic pain syndromes, things like heart disease, things you wouldn't normally associate in your head. And they're starting to learn that it's because of a chronic stress syndrome. And it also, even down at the biological level, they're now showing that trauma effects influences the aging rates of cells. And so that it seems to be why people who have had a burden of violence in their lives actually are at greater risk of some of these long-term health consequences. We also know that the types of violence overlap a lot in women's lives. And so one of the things that I would encourage us to do is to stop talking about specific types of violence, like physical violence rape and war, whatever, and start talking about the life burden of violence. Because what we know is the impacts are cumulative, and that we need to start understanding how these different events may act synergistically. And this is how actually women experience these violences in their lives. We also know, and this is on the upside, that violence is preventable. I mean, in the last few years, there's been a lot of focus amongst donors and everything for the evidence of what works. Can we actually do something on a problem that's so entrenched? And all of these different things that are listed here are examples of studies, of programs that have been evaluated to the highest standard of community randomized trials, showing that within reasonable amounts of time, 2-3 years, we've been able to reduce violence 30-50%. And so I think it's really important for us to start to have this evidence that we can take to give hope both to those who may be funding this work and to those who are in the trenches every day, that actually we do have examples where we have successfully reduced violence, not in a generation, but within a few years. Now, many of you have seen this before in terms of how to think about the origins of partner violence. And I was one of the people who helped popularize many, many years ago this notion of an ecological framework. I think the key idea here is that there is no one cause of violence, that it is the interplay of a bunch of factors acting at different levels of what we call the social ecology. So for example, if you start out with a man coming to a relationship, he comes with a certain genetic endowment, he has his own history and his own history of what has happened to him in his childhood. He has a set of beliefs and behaviors that he brings into a relationship. Together, a woman comes with that same background, and they come together in a relationship that has its own dynamics. One of the things that we see is really predictive of relationships that are high in violence is that there's very poor communication and there's high conflict in general. Those relationships are embedded within communities that have norms and ideas and institutions that communicate to that couple and to those individuals how they should be in the world. And that's embedded in what we call a macro social or macro structure. And that's all of the big, large-scale institutions, the economic structures, how we organize gender, which we call gender regimes, things like market ideology and consumerism, all which influence and filter down through community and then hit individuals as they form their attitudes and their aspirations and behaviors. One thing that we also realize is that there's certain things over and over again that you see trigger violent events. And I like to break it down into what I call patriarchal triggers and then situational triggers. So many of the triggers that you see are when a woman disobeys her husband, or she goes out without permission, or she does something which transgresses an existing gendered norm. Then there's also the things like arguing about children, arguing about money, arguing about all the things that couples argue about that actually can trigger these events. Now, the other thing that we know is if you think about that as some of the origins, one thing that's fascinating is that the rates of violence against women in partnerships actually vary a lot. And it's not as obvious if you look at lifetime violence, but if you look at recent violence, so women who have experienced physical or sexual violence within the last 12 months, you see orders of magnitude difference between countries. So this is data from the WHO multi-country study, which was the first large-scale comparative study that was done that I had the privilege to be involved with. We interviewed 24,000 women around the world face-to-face in representative household survey about their experiences of abuse. And what you see here, I don't think you can probably see the actual individual countries, but you see enormous variations from The two lowest, which is a city in Japan, Yokohama, and Belgrade, a city, the capital of Serbia, which had 3.7% of women physically or sexually abused in the past year, up to a province in Ethiopia where we had 53.7% of women physically or sexually abused in the last year. Now, I could put up many, many countries on this graph. This is just from one study, so it's not particularly Ethiopia. But what the point is how we see these huge variations, which we also see repeated, not just at a country level, but within countries. So what this graph shows you is this is just looking at Brazil, and it's first looking at the capital of Brazil, São Paulo. And what it measures is on your left-hand side is the proportion of neighborhoods in São Paulo that we sampled that had where none of the women were physically abused by their partner, all the way up to, on the right-hand side, your right-hand side, the proportion of neighborhoods that had 70 or more % of women abused. And what you see here is in this region, about 36% of neighborhoods, so a third, the biggest, the tallest part of that graph there, 36% of people lived in neighborhoods where 20 to 29% of their neighbors were physically or sexually abused. If I add this next round, this is the rest of Brazil. Okay, so this is Brazil and rural areas. And what you see is you see the same distribution, okay, so that same curve, that there's a lot of variation, but it's moved to the right, which what that tells you is that on average, more people are abused in these rural areas than in São Paulo. And the goal, when you think about public health approach to this, what we really want to do is we want to move those distribution curves back to the left, right? Because if we can either try to prevent violence person by person at a time, or we can move that whole curve at a population level to the left, which is a really good strategy if we really want to bring down the levels of violence and not just try to save women one at a time. So this work led me to this question of this, okay, we see these variations reproduced all over the world. Well, what does it tell us? You know, what accounts for these differences? And can we use what accounts for these differences to give us insights into what we might want to do for prevention? It also, went the wrong way there. It also leads to the question of to what extent our gender-related factors can help explain the differences, and that's part of what we're looking at here. Now, why I think that's so important at this moment in time is actually the gender hypothesis is under siege in academia. So just to give you an example here, this is from an article, Simply Put, the evidence for theoretical patriarchy as a cause of wife assault is scant. I keep going the wrong direction. Here's another one. The purposes of this article is to challenge the role of patriarchal social norms in the etiology and maintenance of men's violence against intimate partners. So especially in North America, there's now a strong discussion that says, well, gender really doesn't have anything to do with this. I think that probably is not something that most people here agree to. But in fairness to these authors, when they go to look within, let's say, the US and try to look at gender equality measures based on states, they don't see a relationship between gender-related issues and the level of violence in different states in the United States. But that's partly because they're looking at a very narrow thing, and there's not very much variation in in women's status state by state in the United States. So it's impossible for that to sort of emerge as predictive of difference. So what we need in order to do that is we need to be able to look across a whole bunch of different surveys from a lot of different places where there is variation to actually look at whether gender-related factors are important. So what we now have is we have 88 comparable surveys on partner violence from around the world, where you can actually go in and look at the exact same outcome measure. And they were done with the same kind of rigorous efforts to try to maximize disclosure and enhance privacy and all the things that we know that deal with, which help with ensuring the quality of the data. And if you do that, what you can do is you can do something called an ecological analysis. And what that means is instead of asking what is increasing this individual woman's risk, it asks the population question that says, which population factors on average predict a higher level of violence in a particular setting? And so what we do is we use the data from these 88 surveys, and then we compare data either from those surveys or from other information about that country, and it allows us to test certain hypotheses. So one of the things that we've done, and I'm sorry you can't see this very well, but we've gone in and we've said, okay, let's look at, does women's status or differences in women's status predict the level of violence in a country? Does women's economic participation or entitlement predict the level of violence in a country? Does gender inequality, so not the absolute level that women achieve, but does gender inequalities in access to resources and things predict? And what about the roles of norms? So when you do that, what you find, and you can't, I'm sure, read this, but the bottom line of this is that everything is in the exact direction that you would predict. So where women have higher status, where more of them have completed secondary school, where they have higher economic rights, all of those things, levels of violence are lower. In settings where more people think that it's okay to beat your wife, levels of violence are higher. So exactly everything that you would predict comes out in this analysis when you compare across a range of countries. Now, another thing you see, though, that's actually sort of interesting is you see that there's a strong relationship between the socioeconomic level of a country and its level of violence. So the countries that have high-income countries, generally maybe 3 to 4% of women are beaten on average in a year. Some of the lower and middle-income countries have much higher rates. And that raises an interesting question, which is, well, what is it about that level of GDP? Is it the actual amount of money that people have, or is that GDP a marker for something else? And what we realize when we do more sophisticated analysis is that actually GDP is not what's important. It's that GDP is serving as I said before, as sort of a marker for a series of social transformations that tend to go in tandem with economic empowerment and development. So, for example, when you do what's called multi-level analysis, what you find is what's really driving this is the norms around the acceptability of wife abuse and male control of female behavior. And also, two other factors which seem very important are women's property rights, so women's ability to own land and other movable property, and also discriminatory family law. So in those settings where women lose custody of their children, or where they don't have maintenance rights if they leave a relationship, that's very predictive of societies that have higher rates of violence rather than lower rates. Am I out of time? Okay. Well, that's a shame. So just very quickly, I'm going to take 30 seconds and give you a whirlwind through the rest of this. So I think that leads us to a couple things that we need to do. And this is written up, so hopefully you can get more information after the talk. One is, it's very clear that social norms are key. And I think, though, we need to become much more sophisticated about how we think and measure social norms. I think we're doing it very poorly, and there's a lot that we can learn from social norm theory about how to design our programs and how to make sure that we're measuring that change correctly. I think we need to aim younger. There's a lot of data that suggests that young children form their expectations and they understand the rules of gender by the time they're 6. And if we want to actually be able to not have to deconstruct gender roles, but actually work positively, we need to be working with parents about how they raise their children. Likewise, abuse in childhood or witnessing abuse is the single greatest predictor across all settings. And so we really need to focus on violence against children or violence who are witnessing abuse in their childhood. And for this reason, this is just for the, okay, all right. And the final thing is just, I think we need to spend more time on thinking about the role that alcohol and binge drinking plays in triggering violence. And I think we haven't really gotten some opportunities that do exist to try to work on that. So I'll leave you with that, and just to say to have a look out next week in The Lancet. There's going to be a special issue on violence against women that summarizes sort of the state of the field, and a lot of this information will be available there. Thank you.